So wash my hands. My name's Brooke. I'll be your student nurse. Can you tell me your name and date of birth?
Gregory Metters, April 25th, 1970.
Now I'm going to check your armband. Do you have any allergies?
No.
Okay. And then I'm going to provide privacy. Today we're going to be doing a head-to-toe assessment. I'm going to start with the level of consciousness. So can you tell me the year?
2020.
And who's the president?
Donald J. Trump.
Okay. And where are you right now?
At home.
Okay. So next I'm gonna go on to the head. So first I'm gonna have you take your hat off.
My hair's all messed up, but anyway.
I'm gonna inspect for symmetry, masses, and lesions. And then I'm gonna inspect cranial nerve number 5, which is facial symmetry, or it's the facial nerve. So I'll have you smile, frown, puff your cheeks. And then, so that's it for cranial nerve number 7. Everything is symmetrical and relaxed. Next, I'm gonna palpate the cranium, scalp, and hair. Is there any tenderness?
Nope.
Okay. And then I'm gonna palpate your sinuses, starting with the frontal. Is there any pain?
Nope. Nope.
Okay. And that was frontal and maxillary. And then I'm gonna do the temporal artery. Is there any pain here?
No.
And the pulse is 2+, regular rate and rhythm. Next, I'm gonna palpate your TMJ, so I'm gonna have you open your mouth. Okay, and the TMJ is negative because there was no crepitation. And now I'm gonna push against your jaw and have you push down. And this is cranial nerve number 5. I feel like there was something else I was supposed to palpate. Maxillary. Okay. So now we're gonna go into the eyes. So I'm gonna have you, first we're gonna start with the Jaeger test. So hold this about 12 inches from your face, cover one eye, and read this lowest line.
248.
This line.
570.
This one.
639.
Okay, and this one.
248.
Sorry, switch eyes.
248. 570. 639.
Okay, and the results for that is 14 of 14, which is normal. Next, we're gonna do the corneal light reflex. So I'm gonna have you look over my shoulder, and I'm gonna be shining a light at your nose, and the pupils are even, the positioning of them. Next, we're gonna do the 6 cardinal positions. So I'll have you follow my pen light.
Both those eyes?
Yep.
Okay.
Good. 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 And then next we're going to be doing the pupillary reaction. So I'll have you look over my shoulder and then look at my nose. Ready? So look over my shoulder and now look at the pen light. Okay, so the pupillary reaction was brisk, which is good. Next we're going to be doing accommodation. So look over my shoulder and I'm going to shine light from the side. Okay, and everything looks normal within the eyes. The accommodation tested for cranial nerve number 3, 4, and 6, and the Jaeger chart tested for cranial nerve number 2. So then we're gonna go on from the eyes to the ears. So I'm gonna inspect the external structure, the auricle. I'm gonna pull up and back. I don't see any masses, lesions, or redness. So then I'm gonna perform the whisper test, which is cranial nerve number 8. So I have you plug your, go in and out on your left tragus, and I'm gonna whisper 3 words.
Plant. Car. Light.
Okay. And this side.
Lamp. Picture. Table.
Okay. And that was cranial nerve number 8. Next, I'm gonna look at the nose. So first I'm gonna inspect for symmetry, lesions, deviations. Then I'm gonna test the patency. So I'm gonna have you cover one nostril and breathe in, other nostril. And now we're gonna test cranial nerve number 1, which is the olfactory. I'm gonna have you close your eyes and I'm gonna present 2 smells. So plug your left nostril.
Seasoned salt.
And the other nostril.
Mountain Dew.
Yep. Okay, so now from the nose, we're gonna move on to the mouth. So first I'm gonna inspect the teeth, gums, lips, the plate, and the uvula. I'm gonna have you open your mouth and say ah.
Ah.
And the uvula goes up to midline, and that is cranial nerve number 5. And while I'm here, I'm gonna grade the tonsils.
Ah.
And there are no tonsils present, so they must have been removed. So so I'd grade them as 0. Oh, I forgot. Okay. For the TMJ, it's a motor sensory nerve, so I'm gonna do the other part of the sensory.
Okay.
So I'm gonna have you close your eyes. This is cranial nerve. And I'm gonna have you point to where I touch your face. Okay, so now we're gonna go on to the neck. So I'm gonna inspect the neck for symmetry, masses, lesions, anything off-putting, and then I'm gonna palpate the trachea. And then I'm gonna palpate the carotid artery one at a time. Pulse is good, regular, rate and rhythm. Next, I'm gonna palpate the thyroid. So I'm gonna have you put your left ear to your left shoulder. And I'm gonna palpate. Okay, and the other side. Good. While I'm here, I'm gonna auscultate the thyroid for any bruits. So I'm gonna have you hold your breath. Good. You can release your breath. Good. So I don't hear any whooshing sounds, which would be bruits, bruit. Okay, now I'm gonna test the range of motion. So I'll have you turn your head, turn it the other way, touch your chin, and back. And then I'm gonna have you shrug your shoulders. Okay, and this all tests cranial nerves 9, 10, and 11. And then I'm gonna test your strength, so push against me. Push this way, and this way. Okay, so the strength is good. Now we're going to move on to the lymph nodes. So for the lymph nodes, I'm gonna palpate preauricular, postauricular, occipital, submandibular, submental, how you tuck your chin, and then anterior cervical, superficial cervical, deep cervical, and supraclavicular. All lymph nodes present normal with no swelling. So then we're going to move into a mini little skin assessment. So I'm going to assess your skin for color or any lesions or masses, and then or bruising, and then I'm going to have you perform the clubbing. So put your fingers like this with your fingernails together, and I'm looking to see the angle of the fingernails, which is normal. It's 160. Okay, and then next I'm going to do your capillary refill. So I'm going to hold this down and look for blood flow return. And that is normal with 1 to 2 seconds. Good. And then now we're going to move into the lungs. So I'm going to have you turn with your back to Mr. Harvey. So first I'm going to inspect for accessory muscle use or any abnormalities in symmetry, and then I'm going to inspect the respiration rate. So to save some time in the video, I'm going to go ahead and assess and say that it is normal with a 16 rate of respirations. Next, I'm going to palpate the 6 lung fields. So 1, 2, 3, 4, 5, 6. And then I'm going to palpate for tactile fremitus. So I'm going to place my hands in 3 spots and say 99.
99. 99. 99.
And all of the vibration was symmetric. So now I'm going to percuss the same fields. Okay, so they were resonant, which is normal. Now I'm going to auscultate. So I'm going to start at the top, have you take a deep breath. Deep breath. In a normal setting, I would continue the deep breaths, but you can breathe normally. Okay, so breath sounds are normal and bilaterally equal. Now I'm going to perform the CVA tenderness. So I'm going to kind of hit you in the back and tell me if you feel any tenderness.
Nope. 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 Nope.
Okay, good. So now we can put it back normally. So now we're going to move on to cardiovascular. So I'm going to inspect the precordium for any heaves or pulsations, which I don't see any present. So now I'm going to palpate the precordium, so have you sit up straight. For any pulsations, which I don't feel any. Now I'm going to palpate your apical pulse. Which is kind of hard to find. Okay. Now I'm going to auscultate the heart sounds, starting with aortic. I'm starting with the diaphragm. So aortic, pulmonic, herbs, tricuspid, and mitral. I'm going to go backwards with the bell side. So mitral, tricuspid, herbs, pulmonic, and aortic. I don't hear any bruits, so now I'm going to auscultate the apical pulse and record the rate and rhythm. So sit up straight. So I auscultated for a minute, and the pulse was a 62 with regular rate and rhythm. So now we're going to move on to the peripheral part of the vascular assessment. So I'm gonna first inspect the patient for JVD. So I'm gonna have you lay down flat. Okay. So I'm looking for distension in the jugular vein, which I don't see any. And then I'm gonna pull them up 45 degrees, still don't see any. So I'm gonna go ahead and say negative for JVD and put them up straight. Next, I'm gonna go on to the pulses. I don't know why I just grabbed this. So have your arms. I'm gonna assess the radial. Ulnar, brachial, okay, and then let me see if I can put this down. That might work. Okay, so then the popliteal pulses right behind the knees, and the dorsalis pedis on the base of the foot. And then posterior tibial is right around the ankle part of the foot. While I'm down here, I'm looking for symmetry, lesions, discoloration, masses, and normal hair distribution, which everything looks normal. And then I am going to also, where is it? I'm gonna also check the lymph nodes, so your epitrochlear, axillary, other epitrochlear. Okay. So then, I would also do the inguinal lymph node, but not for this class, I guess. So just verbalizing it. Then I would go on to the abdomen, so I'm gonna have you lay down. And I'm gonna assess the contour symmetry, lesions, masses, any bruising. And then I am going to palpate. I'm gonna I'm gonna, can you scoot this way so the camera can reach it just to the end of the seat? So I'm gonna palpate the abdomen in the Z-track form. Is there any tenderness at any point?
No.
Okay, and then I'm gonna go ahead and percuss the same spots. So everything's resonant. Now I'm gonna auscultate with the diaphragm side first for vowel sounds. In 2 spots in each quadrant. If I were to not hear any, then I would auscultate that quadrant for 5 minutes each. Okay. And then I'm gonna go through and do the vascular sounds with the bell side of the scope in the quadrants. So I don't hear anything abnormal. I forgot to do deep palpation. I only did light so far, so I'm gonna go ahead and do that. By the way, I auscultate before I palpate or percuss. I'm gonna verbalize it because I know I kind of messed that up already. Okay, so there's no pain in any of those spots.
No.
So now I'm gonna perform the rebound test. So I'll have you breathe in. And the rebound test is normal. I don't see any distension. Next, I'm gonna perform the Murphy's test, which is testing for appendicitis. So in the right lower quadrant, I'm gonna have you hold your breath and I'm gonna push and tell me if you feel any pain. Ready? Breathe in.
No.
Okay, so Murphy's test is negative, indicating no appendicitis. You can go ahead and sit up. Okay, so last is your musculoskeletal test. So I'm gonna inspect your gait. So I'm gonna have you stand up and walk. So walk down straight normally and back. And then have you walk on your tippy toes that way. And then come back to me on your heels. And I'm assessing the balance and positioning of their gait. You can sit for now. Okay. Where's my stuff?
Stethoscope.
Okay. Now, I shouldn't have told you to sit down. Have you stand up. We're gonna do the Romberg test. So I'm gonna have you close your eyes, provide safety for 30 seconds, 20 seconds, 30 seconds, and this is judging your balance. So 30 seconds went by, and the Romberg test is negative because the patient did not fall. We can go. So I'm gonna have you sit down. We're gonna perform the terms to know. So I'm gonna do adduction, so I'll have you raise your arm to the side and then bring it back down to perform abduction, and then have you put your hands out like this. So supination and then pronation, turn them over, sup. And then we already did dorsiflexion on the foot, you're good. Okay, abduction. Okay, last thing is the passive range of motion on the arms. So I'm gonna have you put your arms out like this, push against me. Now push down on me, good. And then same thing with the legs, push out, good. And then push in, good. And then feet up, down, good. The wrist, so I'm gonna have you push against me, push against me, good. And then fingers, curl them, okay. And then, nope, stay like that. And then push up with your fingers, good. I think that's it. Okay, so then the last thing is the neuro test. So to test coordination, have you do as I'm doing. So connect your fingers to your thumb, each finger, and back. Good. And then we're gonna do the clonus test. So Will you lay down and scoot back so your foot's in the camera?
My foot's what?
In the camera. Okay, so the clonus test, I'm gonna dorsiflex your foot. And it stays, so that indicates a good clonus test. Next, I'm gonna do Babinski while I'm here. So I'm gonna kind of tickle the bottom of the foot. And if the toes go out, it would be positive. So Babinski and clonus are both normal. I think that's it. So range of motion for the neck was cranial nerve 11. Muscular skeletal when you touch your toes was also 11. Optic was the visual acuity. Jaeger 3, 4, and 6 was the accommodation pupillary test. 7 was the gag reflex. 8 was the whisper. I think I got them. I think so. Okay. Well, peace and love.